Center. Dr. Samira, she will talk about the screening program in Medina. هنا هذا forward وهذا backward وهذا المؤشر بس كيف تمشي على الشيء.
بسم الله الرحمن الرحيم. طبعا أشكر الدكتور إبراهيم والدكتورة فاطمة والدكتورة إيمان على المعلومات القيمة اللي أعطونا هي في البداية، واللي طبعا سهلت علينا. اللي حقوله الآن هو عبارة عن نتائج السكرينينج في منطقة المدينة المنورة للأربع سنوات الماضية. انتوا طبعا سمعتوا كثير عن السكرينينج، ويمكن معظمكم أو بعضكم ما يعرف إنه في سكرينينج بروجرام ولله الحمد تقريبا متكامل في منطقة المدينة المنورة، وفي عندنا إحصائيات طلعناها على مدار الأربع سنوات الماضية حنشوفها الآن مع بعض. I will talk about total number of population in Madinah Munawwara, TB screening center overview, and our strategy in fighting against breast cancer, our documented statistics, and our mission. As my colleague mentioned about breast cancer, as it is the most common cancer in women and the second leading cause of death from cancer in women, 1 million women develop breast cancer each year worldwide. Early detection and treatment is considered the most promising approach to reduce breast cancer mortality. What we mean by screening? Screening, it means examination that should be performed regularly for asymptomatic lady. And when they told that it's asymptomatic lady, this is very important point, and the lesion should not be detected clinically, and the screening means that we will detect the lesion before it is felt by clinical examination by 2 years earlier. And I have small comments about this before I switch to the next slide. This means you are here working in primary health care. In Madinah region, you are having 2 separate divisions. The first one is diagnostic breast unit, which is in King Fahd Hospital, and screening center, which is in Taiba Screening Center. This means when the lady came to you with any lesion, any complaint, you have to refer her to the King Fahd Hospital. If she came for you while she is normal lady, you give her referral paper with an advice to visit Taiba Screening Center for screening. Okay? By this, we will not delay the symptomatic lady, and we will give an offer to non-symptomatic lady. Okay? WHO definition of screening test mean it should be accurately sensitive and specific, it should be reproducible in its results, and it should be identify previously undiagnosed disease. It should be affordable and acceptable to the population and include follow-up services. Okay, and here in Taiba Screening Center, I think we fulfill all these criteria, because if the lady came for screening for the first time, she know where she will come next year. And if she need any follow-up, she will do the follow-up here in Taiba Screening Center or in King Fahd Hospital. This means we close the loop. You send the patient to screening. If she is normal, she will go back for a screening next year. If she has any suspicion lesion, we will shift her to King Fahd Hospital, to the breast unit there, and there we will follow her by doing biopsy. And we have every week there in King Fahd Hospital meeting, including oncology, surgeons, histopathologists, and radiologists. This is what Dr. Iman talked about. Every week we have tumor board, we call it tumor board, and discuss all the cancer cases. Okay. Saudi Arabia population, as last estimation, the Saudi population is more than 28 million, including more than 7 million non-Saudi. Medina area population is about 2 million. It is in the 3rd position of Saudi Arabia population. Fortunately, we are having more male and female only 46%. The total number of female is 874,000. And the average age, as we see here, most of the Medina region population from ladies are young, from 35 to 60 years old, and the minority is older than that. This means our targeted group is 323,000. Madinah Munawwara sector overview. Total number of hospitals and the clinic. MOH hospital is 12. Non-MOH governmental is 2. Private hospital is 10. MOH polyclinic is 171. This means it is big number. So we suspect from you big referral number. Private polyclinic is 40. As we know that Taiba Screening Center, it is established in 2009 under Saudi Cancer Society umbrella. It is the first screening center in the Madinah region, providing its cancer screening of breast, prostate, cervical cancer, colon cancer, and screening for osteoporosis. It is equipped by 2 full digital mammography system, and we have 1 mobile track and 1 ultrasound system. Our strategy in fighting against breast cancer is through the primary health care. Or referred non-symptomatic, as I mentioned in the beginning, ladies over 35-year-old can visit Taiba Screening Center or the mobile truck. Also, ladies can visit Taiba Screening Center independently. Okay. When the lady came here to the center, it will be examined again by the general practitioner female doctor, and the radiologist, technologist will do for her a mammogram immediately. The collected mammogram every weekend we will read this mammogram. Me and my colleague, Dr. Reem, we read this mammogram of the collected data in double blind reading, as Dr. Iman mentioned. This means I read alone and my colleague read alone. Then if we agree, it will be, the result will enter in the system spontaneously. If there is disagreement or discordance between our reading, this means it will be marked immediately, automatically by the system. Then we sit together and discuss about this case. And as I mentioned before, if the result is negative, this means the lady is normal. We will give her an appointment next year for follow-up in the center. If it is positive, we'll shift her to King Fahd Hospital for further investigation. If she needs a biopsy, if the biopsy result is negative, she will go back for screening again next year. If the biopsy result is positive, she will go for breast clinic. We have there also now, we developed it before about 1 month, breast clinic in King Fahd Hospital. This breast clinic combined by a team of oncology and surgery. Any positive cases will shift it to this breast clinic. Then they discuss the cases and continue the follow-up with her. Now this is our documented statistics. In 2009, 700 mammogram were done and 160 ultrasound were done. In 2010, more than 1,000 cases of mammogram were done and about 186 ultrasound were done. In 2011, the number increased and we did about 1,800 mammogram and 258 ultrasound. In 2012, actually, the number of mammogram were 3,600 cases. This because of the join of mobile track and because of the combination or activity of primary health care in referring the patient. Before 2012, the primary health care were not involved in the screening in Madinah, but in 2012 they were involved, so the number of patient ladies were increased. The number of positive cases in 2009, 15 cases were sent for biopsy and only 6 were positive. In 2012, 28 cases were sent for biopsy and 15 were positive. In 2011, 48 cases were sent for biopsy and 34 were positive. In 2012, 70 cases were sent for biopsy and only 53 were positive. By the end of December 2012, our targeted ladies who are older than 35 years old were 323,000, but screened ladies only 6,044,100. This means we only screen about 2% of our targeted group, only 2%. This means still it is not high number. Among the screened ladies, which are more than 7,000 cases, we discovered 108 cases were positive. This means it represents about 1.6% of the screened cases were positive. Before I continue, I want to have small comments. During January, February, and March from this year, we screened about 500 cases, and we found 12 cases of them were positive. And when I mention this statistic, I separate the cases of which coming through this only statistic for Taiba Screening Center, separated from the cases which we see in diagnostic unit in King Fahd Hospital. And I think those coming from the Taiba Screening Center representing the minority, but the majority which are coming already have cancer symptomatic through King Fahd Hospital. Okay, this means we are having high number of cancer. Our mission is to cover our targeted group and to cooperate with other screening centers in the kingdom to introduce a successful national screening program. And thanks to you. طبعا أنا عندي شوية كومنت بسيطة للأخوات الطبيبات في البرايمري هيلث كير. إذا كان عندها المريضة أي حاجة لامب أو ديسشارج أو أي كومبلين، أنتوا ما ترسلوها لطيبة. أنتوا عندكم أثوريتي إنكم أنتوا تعملوا ريفيرل لمستشفى ملك فهد. تعملوا ريفيرل لمستشفى ملك فهد، تيجي المريضة تاخد أبوينتمنت، ما هتدخل في نفس الوقت، تدوها خبر إنها هتاخد أبوينتمنت من عيادة تصوير الثدي، بعدين هتعمل الفحص. بالنسبة للأخوات الغير مريضات أو اللي ما عندهم أي معاناة هينتقلوا لمركز طيبة. بكده هنكون فصلنا الحالات المرضية عن الحالات اللي جاية بس تعمل سكرينينج. أوكي؟ في أي أسئلة؟ Yes. By hard disk, no. By hard disk, yes. Dr. Widad was asking me how we communicate between the cases done in the mobile track and in the cases done in Taiba Screening Center. Actually, all the collected cases done via the mobile track, collected and on a hard disk, and we read it here in the center. This is which make us to somewhat different from other screening center in the kingdom, that we are already having our center, not like other sporadic screening programs. Okay, now we will have a break. After that, we will continue at 1 o'clock.